Hello and welcome to the Preceptor Pulse, where we give busy teachers in medical education quick tips for guiding the next generation of physicians in rural and community health.
Hello, I'm Drew Keister, and today on Preceptor Pulse, we're going to be talking about the Precepting Microskills, which are also called the 1-minute preceptor.
Hello, we're joined by Chris Brendamiel, who's going to give a little perspective on precepting microskills and how that could apply for dentistry.
Thanks, Drew. I think that so many of our dentists in new dental residencies, especially, they may struggle to think of themselves as faculty rather than just clinical dentists. There's the old joke that we're just wet-fingered dentists and not anything beyond that. We're just the dentists. So I think that the framework of the 1-minute preceptor is really useful to kind of give our dentists a way to view themselves as an attending faculty and understand the role that they can play, both in supporting the resident, but still sort of guaranteeing high level, high quality patient care. We want to empower our resident or our faculty to be teachers by giving them this framework. And I really loved the framework of getting a commitment first. Like, ask the dental resident, what did they think, rather than just giving them the answer. Because I think many dentists have the attitude of, well, we just need to fix things, or we need to come in and give an answer, versus, what do you think about this? You tell me. I think too many new dentists and new dental residents, especially, they might get into the weeds of explaining too many options to patients and maybe hoping the patient will decide. So getting them to sort of streamline their way of thinking before they go into the patient, getting them to commit to a recommendation, to an explanation with you, I think helps. As faculty, I think asking open-ended questions to kind of drive that and to push them towards the way that we want to be thinking is a really, really helpful tool. We talk a lot in our residency about reinforcing and the framework of reinforcing what was done well, highlighting the good while still providing the critique and the coaching and the teaching. Ultimately, we praise publicly. We want to talk about our residents positively in front of our staff, in front of the patient, but we also need to find those times when it's appropriate to pull away from the patient view and out of their earshot to give them the critical information that they need. The reinforcement of, okay, you did this well, you need to fix this, or this is a problem, and I'm going to step in and help, and here's why. We don't want to undermine patients' trust in our providers, because too many health center patients, or at least in our experience, if they lose trust, they start to just say, I don't want to see students, I don't want to see residents, I only want to see my doctor. And they have the right to say that. And the more we can build up that the residents, these dental learners, are an extension of our hands, they're an extension of everything that we do, and build them up, I think it helps. As a teacher, it helps as making sure that our patients are served well, but also makes sure that our residents are set up for success. Does that make sense?
100%. 100%. Thank you so much. I really appreciate those perspectives. And we'll look forward to having you join us on a couple of other videos coming up.
Thanks.
Thank you for joining us for the Preceptor Pulse. We hope this was a helpful resource for your teaching role.